to another video, my official first sit down video. I want to do a lot more sit down videos. The first two were just practice, me learning how to edit and upload the video. So if you don't know me, my name is Jasmine. I am a licensed professional counselor here in the state of Ohio. I live in Columbus, Ohio. And this is really what I want my channel to be about. Sitting down, answering people's questions about counseling, and you know, just showing the life of a counselor behind the scenes, as well. I'm looking through YouTube trying to find like daily life of a counselor videos or a therapist videos, and I really can't find any. So I'm like, okay, well, if I can't find anything, then I might as well just go on and do it myself. I can't find a whole bunch of counseling videos at all, period. So I wanted to come on here and see what I can start. Maybe I can, you know, start something new, bring something new and fresh to YouTube, bring some education to people, to grown-ups as well as teens. And that's the population I work with. I work with kids as young as 5, and I also have adults that I have who works with. Right now, currently, I work in a school, so I am a school counselor right now. But I previously worked in a psychiatric hospital. I worked in also outreach, community counseling as well, which I just do not recommend to work. I mean, I don't know. I did not enjoy the experience of working in community outreach just because of productivity. If you work in community outreach, you know that you have to get productivity. You have to meet a certain amount of hours per month. That was very stressful, and I just felt like I couldn't do meaningful work there. So I've worked with lots of different people with different diagnoses: psychosis, depression, anxiety, mood disorders and personality disorders, lots of different things, trauma. So I have dealt with a wide range of issues when it comes to counseling. I've done group counseling as well, done some family counseling. Typically, I mean, I'm not a family counselor because there are licensed family counselors. However, like if I do a family session, it's usually one of the people in that family session is probably my individual client. I don't do whole families. So if I do a family counseling session, it's because it was just necessary for me to help the client who I am working with. So for today's video, I wanted to start with a topic that I think is really important. And I think that counseling is now starting to become a trend. More people are more accepting to counseling. More people are trying to, you know, take care of themselves, self-care, go seek help for their different issues. But I think there are still some people who are very weary of counseling, right? And so there's these myths and misconceptions about counseling that's kind of preventing people from going to counseling and getting the help that and support that they need. So I want to just cover in this video some of the misconceptions about counseling. There are a lot of misconceptions about counseling, some that adults have and some that kids have. Like I said, I've worked with from ages 5 on up into adulthood. So I've worked with a wide range of clients, Black, white, different cultures from different countries. So I'm pretty well rounded when it comes to the type of clients that I have. So let's get started. All right, so my first misconception or myth about counseling, I'm going to be looking down and looking away because I did write some notes so I won't forget. My first misconception is counseling is for crazy people. That is so far from the truth. Counseling is not for crazy people. Counseling is for regular, everyday people. Counseling is for anybody who needs somebody to talk to, okay? You don't have to be crazy. You don't have to be depressed. You don't have to have anxiety. You don't have to have a whole bunch of problems to go to counseling. Counseling is just, it's a part of self-care, okay? Somebody who is a support, someone who's not a friend, someone who is not a family member, just a neutral person. A counselor is a neutral person, right? They don't give you, they don't have all these opinions and things like that, right? They don't know you. So that's the good thing about counseling. They don't know you. And not only that, you don't have to worry about, them going and telling your business. And that's another misconception, is that they're going to tell my business. Counselors can't tell your business. Your therapist should not be telling your business, because if they are, you can sue them, okay? They are bound by confidentiality. They cannot share what you say. Whatever you say in the room stays in the room. However, there are some limits to confidentiality. I tell all my clients that are children and adults, okay? If you tell me you're going to hurt yourself, hurt someone else, or you're being hurt, right? Those are the 3 times where confidentiality can be broken, okay? When it comes to safety, right? So if I have any concerns about safety, confidentiality can be broken. However, other than that, there's no safety concerns. You're not talking about harming yourself, harming someone else, or you're being hurt or abused in any way, then what you say in the room stays in the room. You can talk about absolutely anything with your therapist, and you don't have to worry about your business being out there on the street. So counseling is not for crazy people. Your business is not going to be out on the street, okay? Just to have somebody to talk to have an outlet, right? Sometimes we don't have an outlet. Sometimes it's good. We keep things to ourselves. Even just the small frustrations, like counseling, going to counseling is good for the small frustrations, because sometimes going to counseling and having someone to process your feelings and your thoughts with you, you'll start to realize some things that you've never really thought of before. Counseling kind of helps you to see things from a different perspective. And while I'm on this topic, counselors don't really give advice, really, right? Counselors are not really there to tell you what to do, which is another misconception that I had, is that I have to do everything the counselor say do. No, you don't have to do everything your counselor tells you to do. Your counselor is not your mom or dad. They're not there to whoop you. Your counselor is not there to beat on you or to beat you down or nothing like that. Your counseling is there to help you to arrive at your own goals, or at your own self-actualization, or your goal for yourself, your vision for yourself. A counseling is there to help to guide you there, to give you a new and fresh perspective, but not to tell you what to do, not to necessarily give you an advice. They don't give you their opinions, or they don't impose their opinions on you. They don't try to force you to believe what they believe. Counselors totally leave all their thoughts and ideas, personal beliefs outside of the counseling session, or at least they should, because we don't want to be biased at all. I mean, everybody has their biases, but counselors like to make sure they're not being really biased, so they don't impose their beliefs and their values on you. It's more about what you want to accomplish, right? You don't go there to a counseling session and the counselor say, okay, here's what you are going to accomplish. That's not how it works. You go to a counselor because you need something from the counselor. You tell the counselor, here's where I see myself. Here's what I want to accomplish. Here's what I'm going through right now, but I don't know how to get there because of all this stuff that I'm going through. And the counselor, you guys will come up with the treatment plan. You guys will come up with a way to get you to where you want to be, right? It's about you, not about the counselor, not about what the counselor wants. The counselor will encourage you, listen, It's more about what you want and how you want the process to go. It's almost like you're in charge of this session and how it's going to go. Now, the counselor might bring some ideas. You might get some assignments, some books to read. They might teach you some coping tools and things like that. But you know what? You're the expert in your own life, right? Not the counselor. So you don't have to do what the counsel, everything that the counselor says, and they're not there to tell you what to do at all. Which brings me to another one, which is I completely lost my train of thought. That was going to lead into another one. Counselor telling you what to do. Oh yes, I have to. Like, people think that they have to. The counselor's always right. The counselor's always right. And I have to believe everything that they say. You don't. The counselor is not always right. You are the expert in your own life, right? You know you better than the counselor knows you, right? But the counselor is there. If the counselor is saying something and you feel like it's kind of off or you don't agree, it is okay to say, I don't agree. And the counselor can help you to the counselor should be able to gain an understanding of what you're trying to say, or what you want to, the point that you're trying to make, right? And so it's okay to be in disagreement, but at the same time, you still have to be open to fresh perspective, right? Because that's what counselors can give you. They can give you a fresh perspective, another way of looking at things. So let me go back because I kind of went on a tangent a little bit. So my other misconception is that going to counseling means I'm weak. Not at all. Going to counseling does not mean you are weak at all. Going to counseling means you're strong, because going to counseling is a huge step. Like, you really have to get to a point to where you're like, where you have to have courage to go to counseling, because it's not an easy thing to just say, oh, I'm gonna go to counseling. But it really takes courage. I myself, I'm a therapist, but I'm also in therapy and I have a counselor. And it took me, even as a counselor, it took me a while to get to the point to say, all right, you know what? I need therapy. I need therapy. I need someone to talk to. I need to talk through these emotions. I need to talk through these thoughts. I need to figure out what it is that's holding me back. I need to figure out what is the cause of my behavior. What is the cause of the way why am I thinking this way? Why am I feeling this way? What is happening? But that took a lot of courage for me to do. And not only that, me as a therapist, being in therapy, being on the other side of the desk, that was difficult. That was difficult to allow myself to open up, really, only because it's like, I know the whole therapy game. I know, because I do it, but honestly, once you are able to be really authentic, counseling is about you, not about the therapist. You are not there to fool the therapist. Okay. If you're not opening up and you're not being honest about the issues that you're going through, the only person that is being fooled is you. That's it. You have to be open and honest about what is going on with you in your day-to-day life. That is the only way counseling is going to work, is if you are open and honest about what is happening with you. If not, then counseling is going to take a long time, right? It's not going to be beneficial and help you. So if you're not going to open up in counseling, what's the point of being there? You're there for help, right? You know why you came there. But if you go there just to lie or to not be honest, you're only doing yourself a disservice, not the therapist at all. So make sure you are being open and honest. And like I said, it takes courage. So you are not weak for seeking out help and seeking out counseling. You are a strong and courageous person, because it's difficult to talk about trauma. It's difficult to talk about your problems. It's not easy. And I know a lot of people, and I tell my kids this all the time, right? People always tell you to, talk about your feelings, just talk about it, or just talk to someone. It's not that simple. It's not that simple to just talk about your feelings, especially if you've held them in for so long, especially the way I did, holding things in for so long. It's difficult, and it's a process, and it takes time. Okay. So yeah, so you are not weak, you are courageous, you are strong, very strong for going to counseling. Don't let anyone tell you that counseling is for weak people, because it is definitely not. That just is a testament to how strong you are, that you actually decided to go and get some help. And now this one, was my number 3, but I've already said probably about 4 or 5 by now. Counseling costs a lot and it takes too long. Counseling, I mean, it can be expensive, but really it doesn't have to be, because if you have insurance, your insurance should pay for counseling. You just need to find a therapist who takes your insurance. There are agencies and places that go on a sliding fee scale. So they will go by your income, so you don't have to worry about paying a whole lot out of pocket at all. Counselors take insurance. So see go to your insurance website, or check with your insurance to see what are some in-network providers. Check with different counseling agencies to see what insurance they accept, because a lot of it is on their websites. So yeah, do that. It doesn't have to cost a lot at all. And also, if you do like a community counseling agency that do outreach counseling, typically they take Medicaid, Medicare, so you really shouldn't be paying a whole lot. And like I said, talk to them about a sliding fee scale also too. And also, counseling takes a long time. Maybe not. Counseling, you can't put a time limit on counseling. Counseling is a process, right? It's a process. It didn't take you 2 months to get into, this depression or anxiety. It took years. And so it's not going to take you a week or a month or 2 months to get out of it. It's not. You have to trust the process. You have to trust yourself. Like I said earlier, you have to open up when it comes to counseling, because it's not going to do you any justice if you are not opening up about what it is that you're going through. Now, during the counseling process, counselors usually just don't jump into like the big stuff, the big heavy stuff. Well, at least I don't as a therapist. As a therapist, I don't just jump into, your big problems, because sometimes problems are multi-layered, and the problem that you think is your problem is really not your problem. It's something else. So I personally, as a therapist, and every therapist is different, they have their way that they work. I like to spend some time building rapport. For you getting to know me getting to know you. Because again, a counselor is a stranger, and you go to counseling and you tell all your business, but they don't tell you any of their business. That's how it works. That's what I always tell my kids, all right? You are there, you tell me your business, but I don't tell you my business, because me telling you my business isn't going to help you. However, you telling me your business, that's going to help you, because that's what I am. That's what I'm there for. Now, there are times where counselors will do some self-disclosure if it's clinically necessary. I do it all the time if it's clinically necessary. If it's necessary for me to tell somebody something about my life that I know is going to help them, then I will do that, but only if it's clinically necessary. You want to make sure you're not crossing boundaries. You want to be appropriate. So it's the process. The process is only going to take as long as it's up to you, right? It's up to you. If you're not opening up, it's going to take a long time. It's going to drag. If you're in counseling and you're not talking and you're not saying anything, it is going to seem like the time is going so slow. Like it's going to seem like you're in there for hours when you really were only in there 45, 50 minutes. So you have to talk, you have to open up. Like I said, no, counselors don't typically jump into the big stuff right off the back. But if that's something that you want to do and you're comfortable with during your counseling process, that's totally fine. But typically, time is taken to build rapport first before you start jumping into the heavy things. Another misconception that I've heard in my time as a counselor is the counselor's going to take my kids. Okay, the counselor. So even if I'm working with parents and I'm counseling their children, or I'm counseling the parents are always afraid of the system. They haven't had really good experiences with the system. I think our system has failed people a whole lot. So their parents are not very trusting. But rest assured, counselors don't want to take your children. Counselors do not want to take your children. That is the last thing I want to do, is to take somebody's child for them. And the thing is, we don't, at least me personally, let me speak for me, I don't be wanting to call children's services either, because to call children's services is a process. It is a process when I have to make a children's services report. So it is not my goal. I don't go into a family's life looking to take their kids. I do not. I want you to be happy and healthy and a whole family. So that is not my goal. However, if there's a situation that comes up and I am obligated by law to make a children's services report, then I have to, right? That's just counselors. Counselors have to, we are mandated reporters. There are certain things that we have to report. If we don't, we lose our job. But we don't go into a session or a family's life looking to take your kids at all. That is not our goal. We do not want to take your children. We want to help you to keep your children. If you don't have your children, we can do our best to support you to get them back. So that is not our job to do, is to take your children. We do not want anyone separating your family, because that's trauma. That is a traumatic experience. So now you got traumatic experiences on traumatic experiences. The goal is not for us to cause you more traumatic experiences. And along with that, another myth or misconception is that parents don't want kids to tell their business. Don't tell what's going on in our house. Don't tell our business. But the thing is that 9 times out of 10, that business is the reason why your child is in counseling anyway, to be totally honest with you. It is. So these things that you don't want your child to tell, these are the things that's causing them stress. This is the things that's causing that behavior. And those negative feelings all the time. It's that thing. The thing that you don't want them to talk about is the thing that's causing them stress. So and I get the concern behind it, right? Again, like I said earlier, you don't want anybody to take your kids. You don't want anybody to know what's going on in your house because of either safety or because you're concerned about the system. I know it's not easy to trust the system. However, if your kid does not open up, counseling isn't going to be beneficial for them either. Just like if you don't open up, counseling is not going to be beneficial for you. So I can't tell you to stop telling your child that, but just know, if you have your child going into counseling and saying, don't tell our business, how are they going to get help? Because it's literally, I find so often that it is the business that parents don't want their child to tell, is the business that's causing the behavior issues and the mood issues. Okay. So just remember that. And that leads me into another one, is that my kid don't get stressed, or kids don't get stressed. That is so far from the truth also too. Kids get stressed. They get stressed out. They get traumatized. Or I hear parents will say, they don't need to be worried about what I do. Their job is to go to school and that's it. But the reality is, what you do affects your children. The decisions that you make affect your children. Why? Because they have to live in that environment every single day. They do. They have to. Sometimes school is the only safe place for kids, right? And so when there's no school, when school is out, there's a snow day, or even now we're in the middle of a pandemic and they're talking about going back to virtual, right? They lose their safe place. They lose their safe place. And I know parents, they get offended or don't want to I'm just gonna say it. Parents don't want to always take responsibility for the trauma that they caused, or maybe parents don't even know that they're causing that trauma, right? But your behavior, what you do, the decisions that you make affect your children, and because they can't fend for themselves. They can't move out. They can't, go get a job or go somewhere else to live. They can't. So home has to be a safe place too. And if home is not safe for them, it's stressful. It is stressful. Things that are going on at home, they stress your children out. Even me growing up as a kid, I was always told, your job is just to go to school. Don't worry about nothing else. But that's so much easier said than done. You can't tell a 5 or 6 or 7-year-old, don't worry about what is going home. And there's so much other stuff that they're seeing every single day, things that kids shouldn't see. Kids are hearing things they shouldn't hear. And that's stressful and overwhelming, and that affects them mentally. That affects them emotionally. So yes, your children do get stressed. They get stressed out. And when they're having these behavior issues, that is how it's manifesting in their behavior and in their emotions. So stop thinking that your kids don't get stressed. They do get stressed. Okay. And my next one is all counselors are the same. They're all the same. Maybe you've been to counseling before and it wasn't the right fit. It didn't work out. You got mad at your counselor, whatever. And you think, well, all counselors are the same. And that is absolutely not true. All counselors are not the same. Every counselor has their way of doing things. I kind of look at counseling as like an art. Every counselor has I think when you go through counseling and you go through a program, every counselor, you're learning the same things. You're learning how to do some of the same things. You're learning the same terms. However, that does not mean all counselors are the same, because the thing with counseling, depending on where you go after you decide to get out of school, you're going to realize that textbook jargon does not work in counseling. And so I don't use textbook jargon at all when I'm talking to people. When I'm writing my notes or assessments, yeah. But we talk regular, or you should be talking regular, right? You have to meet your client where you are. So we're all different. We all have our own framework that we work by. So we are not the same. So if you feel like you had a bad counselor, you can try again with a new counselor. And another misconception along with that is that people think that they can't choose their counselor. You can choose your counselor, okay? If you are African American and you want an African American counselor, ask the agency for an African American counselor. And if they don't have an African American counselor, find another agency. If you are a male and you want a male counselor, if you are a female and you want a female counselor, you can ask for that. Okay, ask for what you want. It's about you. The process is about you. It's about you and what's going to make you feel comfortable. If you're not comfortable, counseling isn't going to work for you. So it is okay to ask for what you want. It is. Don't be afraid to ask for a Black counselor. The worst they can do is just say, no, we don't have any Black counselors available. Don't be afraid to ask for a male counselor for your child if you feel like your child will work better with a male counselor. Don't feel bad for doing that. Now, sometimes, because if there are a lot of people asking for specific counselors, especially when I worked in outreach, I know we didn't really have a whole bunch of Black male counselors. So it was a little bit difficult. It was probably if they wanted a Black male counselor, they would have to wait a little bit. But ask for what you want, or just, just ask, like, hey, with a Black, I'll get in counseling now, but when a Black male counselor comes available, then that's what I want to get. But it is okay to ask for the type of counselor you want for your child or for yourself. All right. Another misconception is people are going to treat me different if I have a diagnosis or if I take medicine. The thing is with that is that you don't have to tell people your business. Like, you don't have to tell Everybody doesn't have to know that you're taking medicine or what type of diagnosis you have. That's between you and your counselor, you and your psychiatrist. You don't have to share that. Now, however, if you have a family, a husband, wife, or you're living with family, and especially if you're having you have a serious diagnosis, sometimes it's good for them to know, right? Because sometimes it's good for family to know how to help you. So it's important to know for family to know what your triggers are, what are some symptoms and the things like that you're having, so that they can better help you. So don't worry about people treating you differently. If you're and not only that, but people think medicine is for crazy people. Medicine is not for crazy people, okay? Sometimes you need medicine to help you regulate your emotions. You do. Sometimes you need medicine and therapy, because sometimes medicine alone doesn't work. Sometimes therapy alone doesn't work. You need medicine and therapy, even for children. Some people are totally against medicine. I'm not knocking you. I believe in medication. I don't believe that every person needs medication at all, but I believe that medication is necessary. Along with therapy, okay? Medication management along with therapy is so important, because sometimes you need medication in order for you to get through therapy successfully. Like if you're having a hard time regulating your emotions, it's going to be difficult for you to get through therapy indefinitely, because your emotions are so up and down, your thoughts are everywhere. But sometimes you need medication first to help calm you down, get you stable on medication, and then while you're stable on medication, then it's like you're able to think a little bit more clearly, and you're able to now go through the process of processing those emotions. So it is necessary, and it doesn't mean that people are going to treat you differently because of that. You just have to remember that I'm doing this for me. I'm doing this for me. I'm doing this to get my life on track. I'm doing this to make my life better. And so, and that's what you have to keep at the forefront of your mind. And you don't have to be telling everybody your business, okay? It's not, I said, nobody, a lot of people don't have to know. And if, and I get the fear behind that, because I also had a fear behind that. Oh, medicine for crazy people. I'm going to get more crazy if I take medicine. But the reality is, you're not. You're not at all. Sometimes if you might need depression medicine. You might need medicine to control your anxiety. And it is okay. It does not mean you're crazy. It does not mean you're crazy at all. You just need extra help. It is necessary for you to. So remember that. And then the next one is, I already said I have to agree with everything that the counselor says, and you don't. And this says, oh, I have to have a lot of problems to go to counseling. You don't have to have a lot of problems to go to counseling. Literally. Sometimes, again, life has stressors every single day. Like, there's just so many stressors in life: work stress, school stress, friends and family. There's so much going on every day, and sometimes you just need an outlet. You don't have to have bipolar or schizophrenia to go to counseling. You don't have to be majorly depressed to go to counseling. You don't. You could just need an outlet, for about an hour a week to just let everything go and let go of that stress. You might just need some encouragement. Somebody to listen, somebody to validate your feelings. So yeah, you don't have to have a lot of problems to go to counseling at all. Just need that person to talk to. Now, your counselor is not your friend. Your counselor aren't your friend. They aren't your buddy. They're your therapist. Okay. They're your therapist. They're not necessarily a stranger at first, maybe, but they're not your buddy, and they are not your friend. So you shouldn't be having your counselor on Facebook. You shouldn't be on Snapchat or anything like that, because that's a boundary issue, one. And definitely that will be a dual relationship. Okay, your counselor should not be your friend or your family member. So I wouldn't be a therapist to any of my family members. I wouldn't be a therapist to any of my friends, not officially. But I mean, I do have family or friends that come in and they talk to me about their problems, and that's okay. I'll listen as a friend. I'll listen as a sister or a cousin or whatever. But as a therapist, not your therapist. So yeah. And there's a couple that I have from kids. Kids always think that they're going to tell my mom. Like, are you going to tell my mom? Kids always ask me that. Are you going to tell my mom that? Please don't tell my mom. And so they don't like to open up because they think that they're going to get in trouble. And and this is for parents too. Your child, if I'm your child's therapist, the confidentiality is with them. Okay. They have a right to confidentiality. Your child has a right to confidentiality. I'm going to say that again. Your child has a right to confidentiality. So the therapist is not going to tell you every single thing that them and the child talks about, because your child has a right to confidentiality. Okay. You are not the client. The family is not the client. The child is the client. Your child has a right to confidentiality. So I do not tell my parents that I work with everything that their child told me. I don't. Okay. I don't at all. If there's something that I would like to talk to the parent about, or I would like to talk to the teacher about, and it's not dealing with safety at all, I will ask the kid. I said, hey, there's something that we talked about today. I think it will be really important for mom to know, or for dad to know, or maybe we should talk to your teacher about this. Are you okay with that? And a lot of times they are okay with, like, yeah, you can tell my mom, or you can tell my teacher. Because sometimes I think there are definitely things that your kids say is important for you to know. It's not a safety thing. It's not a safety thing, so the counselor don't have to tell you. If the kid's not hurting themselves, hurting someone else, or being abused, they do not have to tell you what is going on in that session. I know that's probably hard to hear, and that's hard for a lot of parents to deal with, but they don't have to tell you what's going on, because your child has a right to confidentiality. And that also helps the counseling be more beneficial to the kid too, because they'll feel comfortable knowing that they have somebody to talk to, and their mom and dad or teacher is not going to know everything. That really helps them to really open up and really to deal with all of those emotions and negative thoughts that they have going on. But I always ask my kids that I work with, is it okay if I tell your mom this? Can we talk to mom about this? Now, counselors should be keeping you up to date on the progress of your kid. Keeping you up to date on the progress of your child does not mean that the counselor is telling you everything. They'll just let you know, like, here's the books we're working on. Here's the behavior that we're working on. Maybe give you a brief summary of, how the session went, but going into specifics about what was said in counseling doesn't usually happen. And I don't know if some counselors do that or not. But I know with kids it's kind of tricky, but we don't, I don't tell everything, parents or teachers or the school. And even stuff that family tells me, I don't tell the school everything. The counselor shouldn't be telling the school everything, because there are some things about families that are confidential, things that that schools don't need to know. If a family tells me something about the child that I feel like is beneficial for the school to know, I will ask permission to talk with the school about it. But your counselor is not going around telling all the school your whole entire business. There are some things that are still confidential. So there are things that I know about families that the school does not know. And that's okay, because that's how it's supposed to be. These are two separate entities, and you would need a release of information. So even if you're dealing with other agencies, if you're having, your primary care provider, right? There might be things that I know that they know things that I don't. So it's just about, we'll have releases of information. There's legal documents and everything that go along with that, in order to share, information back and forth. So, you know, so don't, so kids don't worry about the counselor telling your business, and parents don't worry about the counselor telling the school the business. Counselors should not be, doing that, because you have a right to confidentiality. It's not necessary for, the school to know everything, that is going on, in your household. However, if I feel like there's something that I feel like it'll be beneficial for the school to know or for the teacher to know, I'll ask permission, first before, I do that, just out of respect for the family, and the child, as well. Because I think schools don't have the same, they're not bound to confidentiality like counselors are. And not only that, they don't work always from the same, code of ethics as well. Sometimes, even if it isn't a confidentiality issue, sometimes there's just some things that are just unethical to do. And you should not do them. Maybe won't get sued for or whatever, but sometimes just some things are just unethical and unnecessary. So everything is not clinically necessary to share. If it's not helping the child, then we don't need to be, sharing that. One more thing, kids always think, and adults too sometimes, counselors don't have any problems. But let me tell you, counselors have a whole lot of problems, okay? We have a whole lot of problems. There are times where we don't know how to deal with our own problems. So counselors are human beings. We have problems. But when it's time to go to work, you as a counselor, you got to be able to, put your focus on your client, or the family that you're working with. Now, counselors do need to be aware of when their personal life is affecting their work, because it can happen. Your personal life can affect your work. Something that you're called transference and countertransference. Something that is said could affect you. There's been many times where I've been triggered, especially when I worked in a hospital setting, where I was, triggered. But you have to, make sure as a counselor, you have to take care of yourself. So counselors do self-care. And we do have problems. But also too, we go to school. We go to school for this. To be a therapist, you have to go to school. You have to be state tested, to help people with, with their problem, because these are people's lives that you're dealing with, right? This is a life. This is a person. This is a human being, right? And we just can't, say anything to people, and you can't treat people any kind of way. You can't come into, because you're coming into people's lives. Sometimes you're in there, as a therapist, your therapist is in there for the long haul. And so it's important for them to, be well trained, and to know what to do and know what to say, and know how to handle, families. Because you all go through a lot. You've seen a lot. And sometimes you've been through things that we could not even imagine, what you've gone through. There are a lot of things that clients have gone through that I have not experienced. However, there are some things that my clients have gone through that I have experienced. And, but also too, I understand that their experience is still not my experience. And so we're trained professionals, but also we are human beings. And counselors will respond to things emotional, with emotion too. So yeah. So those are the misconceptions about counselors. I have one more here too, that counselors think, that kids think always think counselors are rich. I have so many kids, think that I'm rich as a counselor, or again, that I don't go through things. I am not rich, let me tell you. Okay. I'm not a counselor because I wanted to become rich. I already knew for a fact that I would not be rich, being a counselor. So we are not rich. We do not have money. Okay. Some of y'all got more money than we do. So I know that for a fact. So, So yeah, I appreciate you all for tuning into this video. Like I said, don't be afraid of therapy. Therapy is not, it can be a scary experience at first, but it's very, very beneficial. Therapy is what you make it. You are in charge of how you want it to go. You are there to tell the therapist what you want to work on, right? You don't come in the door and we don't say, okay, here's all the things you need to work on, right? It's not about that. You tell, hey, here's all the things I want to work on. And so now we're there to help you. Okay, how can I help you arrive at your goal? How can I guide you there to the life that you want? And that's what it's about. So yeah, so I appreciate y'all sticking with me in this super long video. I hope it was helpful for you. I'll be coming with more videos as well about counseling. And if you have questions, share, comment, subscribe, hit the notification button so that you can know when I post a video. I'll try to I need to get on a whole system of how I want to post videos, or a schedule, video posting schedule. I don't know exactly yet because I'm just so new to this. So bear with me as the video quality gets better, as the content gets better. Yeah, and we'll see where we end up. Thanks again for tuning in. Bye.